Good evening, everybody. We're now it's all gone dark. When we've started doing the webinars, it was all lovely and bright everywhere. So things are obviously changing, and welcome to this webinar all about autoimmunity. So my name is Dr. Indra, and I have been the founder of Dr. Indra FMGP, and we've been sort of together as a team now probably for about 2 years. I'm just going to introduce my team. Elsa.
Hi, I'm Dr. Ailsa.
And we have Dr. Meeta as well.
Hello, good evening, everybody.
And we have Fiona, one of our health coaches.
Hi there, everyone. Yes, I work as one of the health coaches. Hope you're going to enjoy this evening.
Thanks, Fiona. And then we have Roz, who is the star of our show today.
Hi, everybody.
Right, so what we're going to do today is that we're going to talk about autoimmunity, and Roz has kindly allowed us to sort of interview her and she's been through this process as a functional medicine patient, and she has to have had an autoimmune condition. So we thought it'd be quite useful to see it from a patient perspective as well. And hopefully we'll pull out some of the things that we want to sort of explain about a functional medicine approach to autoimmunity. So first of all, autoimmunity, it is something that's rising in the world. I think there's over 80 different autoimmune conditions that I know of or that are coming through in the world at the moment. And it's like an epidemic that's happening out there. And we find that there's a lot of patients have autoimmune components to their illness. And really with functional medicine, one of the key things that we're dealing with is inflammation. And inflammation is the body's way of defending itself and bringing itself back to balance from some kind of threat, stress, toxin, that kind of thing. And for some reason, things tend to go a little bit awry and the body starts attacking itself. And that's what we call autoimmune conditions. Now, there's been a number of different studies done about what they think is the underlying issue with autoimmunity. But one of the things that comes through in a study that we've seen probably in the last 4 or 5 years, maybe a little bit longer, is a study done by an Italian scientist who I think is now in America. And he was doing a lot of work on celiac disease. And he basically said there's 3 components to autoimmunity. Oh, I've just realized I've not introduced Elaine, who's also here. But anyway, hi, Elaine.
Hi, everyone. Sorry, I switched my video off.
No worries, just realized. So autoimmunity. So what he realized is when he was doing the research that there was 3 components to developing an autoimmune condition. One is a genetic predisposition towards some kind of autoimmune condition. The second thing is a leaky gut or an increased gut permeability. And I think Elsa will talk a little bit more about how that's really important in autoimmune conditions. And the third thing is some kind of trigger that changes the immune balance within the body. So those are the things that we're looking for when we are assessing a patient from an autoimmune perspective. Actually, those are things that we're looking for in any patient that we're seeing at the practice, because inflammation is kind of the root of what we are dealing with. So I've come up with sort of 3 questions that I want to know when I'm seeing a patient who has been diagnosed by conventional circles to have an autoimmune condition. Number 1, where is the pressure, stress, or threat? Is that an external pressure? Is that a psychological pressure? Is that a chronic infection pressure? What is the pressure that the body is dealing with? What is the threat that the body is trying to correct itself from? Number 2, what is the state of your gut health? And a lot of people may not even have gut issues, but they may have food intolerance issues, or they may have an occasional diarrhea or an occasional constipation, which they have sort of found to be just normal now. But actually, there may be an indication of an imbalance going on. And the third thing is, what can we do to reduce the inflammation? So those are the three questions that we are kind of thinking about when we're thinking about autoimmune conditions. So what we're going to do now is we're going to dive into Roz's story. And as we go through that, we're going to kind of bring in our colleagues to try and talk a little bit about different aspects and dive down a little bit more. Does anybody else want to add anything to that introduction? Is that all? That's okay. Perfect. So Roz, thank you so much for allowing us to speak to you today. I think it's really important for people to see it, that there's a real live patient and what you've been through. So we've kind of had a little conversation before about what you went through. So I'd like you to just start with your story. When did it all happen, and what were the first things that you first noticed?
It all started in February 2016. It actually came on quite quickly. I first of all noticed that my right knee was clicking a little bit as I was kind of doing a school run, and very quickly, within a couple of days, it was swollen, and then everything else swelled up. So wrists, hands, shoulders, knees, ankles, all were very swollen, basically. And that was kind of it was really kind of rapid onset at that stage. Retrospectively, I could kind of look back and think that there maybe had been kind of previous issues that I hadn't recognized as being a problem. I just kind of accepted them as being normal. Things like a bit of hand stiffness over time, and abdominal kind of bloating. We used to call them my pasta babies.
Yeah.
I'd have a bowl of pasta and immediately I'd look 6 months pregnant, but I didn't know that it was a massive issue. I just kind of assumed that was normal somehow.
And that's one thing we see, isn't it, with autoimmune diseases? Even though it feels as though it drops out of the air, there's probably been a history of things that have been happening. And as I was saying when I started, we think we have no gut issues, but when you start looking backwards, you think, oh yeah, that was already telling me that I wasn't quite okay. So what did you do? That must have been quite frightening for it to sort of all appear.
Yeah, it was quite alarming. And so I went to the GP, and she kind of referred me on to rheumatology. I did have an inclination of what it was because my maternal grandmother had what she called rheumatism. And so I knew about kind of, rheumatoid arthritis and things like that. I was kind of aware of their existence, and I kind of knew what the symptoms were. I was given steroids in the interim for a week by the GP because I couldn't sleep. I would sleep in kind of incremental kind of 45-minute kind of sections until one of my arms would go dead, and then I'd have to kind of sit up and try and get the life back into the arm, and then I'd roll over onto the other side, and then eventually I would sleep sitting up because it was the only way I could actually get any sleep without my arms going dead. And I was in a lot of pain and discomfort.
Did you know anything about autoimmunity? Was that even part of your thinking? You knew about rheumatism, but did autoimmunity even come into your mind at that point?
Not specifically autoimmunity. I was aware of rheumatoid arthritis specifically because we do have kind of a family friend who had been diagnosed with that quite young, and so I was aware of the condition.
Yeah.
And I was aware of kind of osteoarthritis and things, and I was aware that there was a difference.
Yeah.
So I think I knew kind of what it was, really.
Yeah. And that comes. Sorry to carry on.
I was going to say that the steroids did have an impact, which again was an indication that was kind of what it was, but then the GP only gave me a week because she wanted the rheumatologist to be able to see just exactly what was going on when I had my consultant appointment.
So when you went to the rheumatologist, did they diagnose you at that point, or?
Yeah, I'd had blood tests done, and you know, he gave me a kind of a physical examination, and I think they did some X-rays. And yeah, he diagnosed me with seronegative inflammatory arthritis because there wasn't any rheumatoid factor in my blood, but all the symptoms were kind of, you know, were there basically.
Excellent.
Then they prescribed me with hydroxychloroquine and methotrexate, and gave me a steroid injection, and gave me ibuprofen and omeprazole and codeine. So yeah, lots of medication.
How did that make you feel? Was that quite?
Oh, horrible. I think I cried the night before I had to start taking the methotrexate, just because I'd kind of read around it and what it, you know, what it was and what the side effects were, and it just felt awful to be in a position where I had to take all these kind of powerful drugs. So yeah, and to be told that you have to take them for the rest of your life.
Yeah.
As well, it's quite a blow, shall we say?
Yeah, no, definitely. It's a lot to take in at a young age as well, isn't it? To think that this is what.
Well, yeah, and also I mean I'm kind of, you know, I used to be a ballet dancer, and you know, I'm very kind of active. You know, I did Pilates and yoga, and you know, I kind of, movement's a huge part of my life, and to think that that would be curbed then forever was quite a kind of a tough one to kind of contemplate, really.
So that self-awareness of your body was shouting out at you, was it, at that point?
Yeah, I think so, and I think that's probably what played quite a large part in me looking for answers elsewhere as well.
Yeah.
From the kind of conventional kind of, you know, just taking the medication and accepting that that was my life. Then I didn't, you know, I thought there's got to be a better way, because I wanted to be able to move again properly. I wanted to be able to do all the things that I wanted to do with my life without pain. And
had you ever looked at an alternative? Had you thought of alternative ways, or is that something, did Dr. Google come into play?
Yeah, absolutely. I mean, kind of, I've always been quite interested in kind of, you know, other things other than, you know, specifically conventional, just for kind of, you know, complementary therapies. I used to do sports and remedial massage.
Okay.
You know, I've kind of, you know, I'm interested in things like, you know, reflexology and all the kind of osteopathy, and so I've never been kind of a completely conventional person, I suppose. So I had some degree of knowledge, but I'd never heard of functional medicine before at that stage. But I had heard of kind of nutritional therapists. So that was kind of, you know, alongside Google, I decided I was going to speak to a nutritional therapist who I knew. So yeah, that was the kind of the first step really in me discovering that there was another possibility.
So at this point, before you go to see the nutritional therapist, you were on all the medication. How were you feeling? Were you still in pain, or had everything settled down?
I think to a degree things had settled down, but I wasn't normal by any stretch. And the side effects from particularly the methotrexate were pretty horrible. It was kind of almost like a different set of problems from taking that. And I used to take it on a Sunday night so that the side effects didn't affect kind of the weekend with the children. I didn't kind of ruin the weekend, and then I would take it kind of Sunday night, and I probably could function again by maybe Tuesday lunchtime. And by function, I was still very fatigued. It wasn't really, it was kind of, it felt like I was kind of going through the motions every day and doing the things I had to do, but really wasn't kind of living life the way I wanted to live it.
So that's one of the symptoms that we see a lot of in our autoimmune patients is fatigue, isn't it? It's
yeah, that was a big part of it. And also going back to what we were talking about before, I think I hadn't recognized that I was extremely fatigued beforehand, and I put it down to having, you know, 2 children and, you know, a kind of busy life. So yeah.
Awareness is one thing that you definitely now are aware, aren't you? With
Oh, yes, definitely.
how your body's feeling. So you went to see this nutritional therapist, and they recommended you to change your diet.
Yes.
And how did you find that? What did you have to take out?
She recommended that I take out gluten, dairy, and sugar. I think the kind of pattern of events was I'd had to come off the methotrexate because my white count had got too low, and I'd seen her, and we were just about to go away on holiday to France of all places. And I was thinking, how do I do gluten, dairy, and sugar-free in France?
Quite tough, that one.
Yeah, but I was kind of really motivated because I didn't really want to live the way I was living, so I did it. In the first week of the holiday, I, you know, was very limited in what I could do. I think I'd basically kind of lie by the pool, watch the kids. And then by about 4 o'clock, I couldn't function anymore. I'd go to bed. And I noticed by the kind of second week that I'd noticed that I got a little bit more energy. And it felt quite significant. I mean, nothing major, but it felt like a shift for me. And then by the time we got home from the holiday, and I had my next rheumatology appointment, which was probably about a month. So I'd been doing probably the diet for about a month by then. I felt kind of significantly improved that I didn't want to go back onto methotrexate. And so I said to the consultant that I didn't want to. They weren't awfully happy with me. They wanted me to go back onto it again or try a different drug. But I just wanted to see, because I was still on hydroxychloroquine at that point as well. So that's what I did. I kind of continued to kind of improve. And within that time, I then had kind of done lots more Googling and discovered the Institute of Functional Medicine, and decided I was going to see a functional medicine doctor to kind of move me to the next step, so to speak. Yeah.
So when we're talking about what you did with your nutritional changes and things like that, I'm going to bring Ailsa in, because Ailsa's going to talk a little bit about food intolerances and how that impacts, and then it makes us understand a bit more about why you probably felt better by removing, and how I think there's quite a bit of evidence now about the impact of gluten on our gut and how that obviously fits in. So Ailsa.
Yes. Are you okay to put the slides up for me?
Yeah.
Yeah. So I'm just going to explain a little bit about the different kinds of food reactions that you can get, because there are all sorts of terms that are used, from food allergy, sensitivity, intolerance. So probably about 1 in 3 people say that they have some kind of reaction to foods. And that's because the role of our immune system in our gut is actually to work out whether the food that we're eating is friend or foe. And our tolerance to foods depends on different factors, including our genetics, age, gender, whether we've got an intact gut lining, so whether we've got leaky gut or not, and also the balance of the gut bacteria, as well as the type of food that we eat, and also how much of it we eat. We're far more likely to develop reactions to foods that we eat on a very regular basis. So in autoimmunity, there are two things that you need. I call it the perfect storm. So if you are not completely digesting your food, you get larger food protein molecules that are present in the small bowel where absorption happens. And if you've got leaky gut, so the holes in your sieve are larger, if you like, they let through these larger protein molecules, which then the immune system that is, there's probably 70–80% of our immune system is actually in the gut lining. And when it sees proteins that it doesn't recognize, it will react as if they're foreign, as if they're foe, and mount an immune response. And when they mount an immune response, often there is cross-reactivity between those foods and certain tissues in the body. So, for example, gluten. There are stretches of the gluten protein that look very like thyroid tissue. So that's where you can get thyroid autoimmunity, because your immune system is mistaking the thyroid tissue for the gluten molecule. So just to explain a little bit about leaky gut. So in the small bowel where absorption happens, the lining is only one cell thick, and those cells should be fairly closely butted up against each other so that they only let through a section of protein that's maybe 3 or 4 amino acids. They're the building blocks of protein. They only let through very small sections of amino acids, which are not interesting to the immune system. But there are certain things that can disrupt the lining of the gut and make those tight junctions wider. And then if you're not completely digesting your food, you get these larger stretches leaking through. And the things that can disrupt the gut lining are stress is a big one, abnormal bacteria, infections in the gut like yeast or parasites. Alcohol is a disruptor of the gut lining, and pro-inflammatory foods like gluten, some medications, anti-inflammatories in particular. So Indra, could you put the slide up about the different kinds of reactions for me, please? The one with blue circles.
Yeah, that's the one. There you go.
Yeah. So you can divide food reactions into those which are immune mediated and those which are not mediated by the immune system. And of the immune mediated ones, there are IgE reactions, which is what you would think of as a true allergy. So it's an immediate, quite catastrophic reaction to something like a peanut. And it's usually pretty obvious what has caused that reaction. But then you get IgG reactions, which are what we call delayed hypersensitivity. And those reactions can come on any time from an hour or so after eating to maybe even 4 days later. And given that it takes maybe up to 4 days to clear a food through your system, if you eat something twice a week or more, it's actually never out of your system. So you don't get that clear aha moment that you react to that food. And then the non-immune mediated ones, sorry, I won't really go into, but they can be toxic reactions, either a food or chemical poisoning. And then non-toxic reactions might be an enzyme deficiency like lactose intolerance, or histamine reactions, or reactions to food additives. So how do we test for food sensitivities? The gold standard has always been to do an elimination diet, and there are many different elimination diets, and we would probably tailor them to the person. So Ros, you just took out gluten, dairy and sugar to start with. And that's a really good place to start, because sugar is pro-inflammatory, and gluten and dairy are probably the top two sensitizing foods. And you can see from, if you go back to the previous slide, Indra, the one with the food reactions. Yeah, there we go. Yeah. So food reactions can give you all sorts of different symptoms in all different body systems. And you can't really tell without doing an elimination diet whether those symptoms are going to clear up or not. So how did you feel doing the elimination diet, Rose?
Well, I did the kind of three, obviously the gluten, dairy and sugar, and then when I went to see the functional medicine doctor, then I went on to a kind of a full-on elimination diet. And I found that really useful. I then kind of really started to explore food myself. And over a period of time, I went vegan for a month to see how that would impact me. I also did the autoimmune paleo diet, which was really, really useful in identifying kind of exactly what causes me a problem. And what I recognize from that is, I think that not one size doesn't fit all. There are kind of, as you mentioned, the kind of the top few things that cause problems. But it was really kind of good to get down to kind of the nitty-gritty to see what worked for my body, and the way I felt the best, kind of what I ate to make me feel the best I could feel. Yeah. And for me, I settled on kind of you probably would describe it as maybe a bit paleo, a bit lower carb, but not majorly, and real food. Yeah. And there are kind of certain things that cause me problems that I don't really eat.
But I think you would say that that's individual to each person, isn't it?
I think so. And I do agree with the whole kind of gluten and dairy. I think I don't consider that I will ever eat gluten and dairy again. I do occasionally have sugar, but not very often. And it's kind of rare for me to do that. And then there are certain things, like there are a couple of types of beans that I struggle to eat. But yeah, it was kind of a really interesting kind of exploratory kind of adventure, in a sense, with food over a period of time, to kind of get to where I am now, where I kind of feel comfortable. But yeah, I mean, I massively increased the amount of veg that I eat and the variety. I mean, I used to eat what I thought was a really good diet, and in a lot of ways it probably was, but in some ways I did eat a lot of veg and fruit before. But I did eat, well, my favorite food actually was pasta carbonara, so clearly that wasn't doing me any good. But yeah, I mean, I think it was a really kind of big motivator, because I did notice
the changes,
yeah, and it did have a massive impact. And over this period of time as well, I was kind of ended up reducing the hydroxychloroquine, and I wasn't taking the anti-inflammatory, the other drugs either. So I was kind of gradually reducing those down.
Was that with the support of your doctors?
Yes, I was still seeing the rheumatologist regularly over this period of time as well, and they kind of monitored kind of my bloods and all that kind of stuff. They weren't particularly supportive of what I was doing, and I did meet with some resistance, and about kind of it not making a difference, but I kind of I felt different. So it was, kind of stuck to my guns, I think, you know.
So from learning about your nutrition and understanding now, we can understand that there's so many different food reactions and things like that. You then went on to see the doctor and then had some testing done. And you said to me before when we were speaking that the testing was kind of a massive aha moment for you.
Yeah, it was very significant. I had kind of the nutritional deficiencies tested, and also some genetic testing. And it was just really interesting from the perspective of figuring out how my body worked on a kind of very unique level. And I discovered that I have some SNPs on some of the genes which work on detoxification. And I started taking all the kind of the supplementation to balance kind of the nutritional deficiencies I had as well. I think B12 was quite significant for me within that kind of methylation cycle. It just made a lot of sense to know all these things and to have some sort of reason, you know, behind it all, to understand where it was coming from and why it was happening. Because I am the kind of person who, you know, likes to Google things and likes to know, likes to understand. So for me, that was really important.
That's great. We're going to just bring in Mita, who's going to talk a little bit about the testing that Ros had, because it's something that we do at the practice, and we obviously decide with the patient what the most appropriate test is. Because the one test, or what's called metabolomics now, I think, if I can say it correctly, has got so much information. It can be a little bit overwhelming, can't it, Ros?
It can be, but for me, I wanted all that information.
Yeah.
I wanted to know why this was happening.
Yeah.
I wanted to make sense of it all, and I think that was for me. It was really important to have all this information and to understand it.
Mita, do you want to tell us a little bit more about genetics and testing and things?
Okay, so if we talk about the genetic testing first, as Ros has shown us, it can be a useful tool for us in terms of educating the patient and also understanding potential root causes. The genes are only 30% the risk, and the rest is really all about our lifestyle. We don't have to bow down and submit to our genes or DNA. Instead, as Ros did, we need to work with our genes and create optimal health. And Ros mentioned SNPs. So SNPs is an abbreviation of SNP, which is single nucleotide polymorphism. And there are roughly about 10 million SNPs that we've identified now in the human genome. And each of us have over 1 million SNPs, but before you start to panic, most of them don't seem to affect us very much at all. But some can make a huge difference to our health and even our personalities. And for Ros can create a whole host of health problems. So SNPs can give us an idea of how we respond to the environment, and it's not something that we need to have done necessarily to start our journey back to optimal health. But like for Ros, it helped for her to understand how her body was functioning. It also helped for her to understand specific SNPs that caused her to react to drugs like methotrexate. So yeah, so that's about the genetics and the SNPs.
Definitely.
Can I just add there, Mita, that what the kind of the report revealed for me, you just mentioned with methotrexate, is that one of the SNPs I had, it's recommended that you don't ever take methotrexate. But yet, and that kind of almost explains why I felt terrible when I did take it, in a very different way from, you know, the kind of the way the arthritis was making me feel. It kind of created a whole other host of problems because of the genetics. So that was kind of quite interesting to know that there was a reason why I felt so
Yeah,
bad.
especially when you have consultants in rheumatology and people in the hospital trying to encourage you with these kind of drugs, and you don't want to sound like you're going mad. But if you have an understanding of your own body after the testing, then you can feel quite rest assured that you know what you're talking about for yourself.
Yeah, absolutely.
And then the metabolomics testing that we do at the practice is a urine test, and that looks at so many things, but in a nutshell, we're looking at nutritional deficiencies and gut health, and it tells us things about things like glutathione, which tells us about detox support needed. It's really important to consider the nutritional deficiencies, which fortunately Ros started to look at that once she'd found a functional medicine doctor, because the nutritional deficiencies have an impact in your ability to detoxify properly. And for example, antioxidant nutrients and phytonutrients, they help in our detoxification pathways. So if you're deficient in them, for example, zinc, copper, or selenium, then you're not able to detoxify. So it's all about nutrition, replenishing, and reducing toxin load.
It's interesting, isn't it, Ros? So you thought you had a so-called okay diet. Even with that, you were still, there was nutritional imbalances there.
Yeah, absolutely. I think, and probably when you consider kind of your standard British diet, I probably was on the kind of the better end of that. But still, I don't think I was absorbing my nutrients. My gut clearly wasn't working as it should. I think something else that was discovered was that I wasn't producing much stomach acid. So I wasn't really digesting, I think as Ailsa was talking about earlier on, I clearly wasn't breaking down the food sufficiently well, and I clearly had leaky gut. So, all this kind of contributed to kind of the development, this kind of perfect storm of, to create the kind of advent of the kind of symptoms.
So what we can see here is we've talked about nutritional deficiencies. We've not really talked about the trigger, but we'll come on to that in a second. We talked about the genetic predisposition. And one other thing that you also was going to mention as well is mercury, because I think that came up a little bit on one of your testing.
Yeah, I have quite a lot of amalgam, or had quite a lot of amalgam fillings. So that was something else that we considered, and I did actually have those all removed by a holistic dentist, because it just seemed like what I wanted to do was to just tackle all the kind of possible issues that there might be in my life, to actually make sure that I was doing everything I could to feel the best that I could.
And I think that's really quite important, because the functional medicine approach is not about the magic bullet in any way. It's about looking at the whole picture, isn't it? And that's the reason, as a team, that's why we've created this team. So we've all got our specialist areas to look at. So we have the doctors who are kind of looking at nutritional deficiencies, and the blood testing and all of those kind of things. Then we have Shakila, our nutritional therapist, who's not here today, looking and supporting patients, because that's, you obviously had the ability to be curious and to just kind of look and deal with your nutrition. And then obviously we have our health coaches. I'm going to ask you to talk a little bit about the impact of maybe what health coaching is, and Fiona's going to ask you a little bit about that.
Hi there, Roz. Yeah, the first thing that I'm interested in from one health coach to another, how do you think health coaching would have helped in your recovery from arthritis?
You know what, I think it would have been really, really helpful. You know, I was really motivated, and, you know, as Indra said, really kind of curious and interested in the subject anyway. But I think just to have somebody kind of giving me a little bit of guidance and support through that process would have really, really, you know, made it easier. And just having somebody to kind of celebrate those kind of small, celebrate the progress, the kind of the wins, and kind of be there if I was struggling, would have been really helpful. Yeah.
And you did go on to have some health coaching. So having gone through that experience too, what would you say would be the main benefits of that health coaching support?
I think the accountability is a big thing. I think the support in finding my way through the kind of the barriers that maybe I was kind of putting up maybe at times, and kind of helping with a bit of a shift of kind of perspective at times, was really really beneficial. And you know, just kind of getting a bit of clarity, I think, in how I was feeling and what I was thinking, and how I wanted to move forwards. I think those are the key points.
And the fact that they moved forward at the same pace as yourself.
Yeah, very much so. It was, you know, it's very much it was very much tailored to me, and it's not about you know, being told what you should be doing. It's very much a guide and a support, and somebody kind of empowering you through the journey, because it isn't a quick fix, as Indra was saying earlier on. It takes time and patience, and it's frustrating at times, and sometimes you just want to scream, and you know, it's just nice to have somebody there who kind of totally gets it. And I think that's ultimately why I ended up training as a health coach, because I just wanted to be that support for somebody else. And you know, that's why I trained and set up my aubergine coaching business, and prior to kind of then joining in this team, which is a really kind of brilliant way of working, because you get every single aspect of support that you need to actually help you through this journey, which is not easy. You know, and having the support of the doctors and the nutritional therapists and the health coaches, I think it's just a really wonderful way of working. Really pleased and delighted to be part of it.
Yeah, absolutely. I feel the same, Roz. So how do you feel that having gone through that journey, having had those pitfalls and difference of opinions, say from the consultant, how does having an autoimmune health issue enhance what you do as a health coach?
Well, I think the most important thing is that I've been through the process, and I understand, and I genuinely can relate and empathise with how the person is feeling, and I think that can be really important for some people, because I think, particularly with autoimmune conditions, there can be a very hidden illness to have, and you know, I think it's not necessarily visible. You know, fatigue is not visible. You know, the pain in your joints is not necessarily visible, and I think sometimes explaining that to somebody who's never been through it is quite difficult at times, and having, you know, really getting that kind of understanding. So I think it just gives me a different degree of understanding. And I do, in my own business, I do work with people specifically who do have autoimmune conditions, and you know, the response I've had is it is really beneficial for somebody to really do know, you know, how you feel.
Yeah.
Ladies, we've got a question. Everybody, we will answer the questions, but this one sort of seems right for this time. Sherza is asking, could you give an example of example of health coaching?
As in a short little case history?
Just something that maybe, Ros, that you found health coaching to support, or what it did for you, like a particular, I don't know, situation that you were able to work through with it.
That's really tricky, because I think it's so unique to the kind of the client, and everybody's needs are so different.
Is there anything that stands out from your health coaching that you think, oh, I did not realize that? Or
yeah, I mean, I'm sure there were. It was quite a while ago now, when I was personally having the health coaching. But I think it's sometimes it's just connecting the dots, really, between kind of one thing and another, and sometimes you don't necessarily it doesn't necessarily register with you. And I think the way that you coach somebody, it's very much kind of helping the person to figure it out for themselves. It's not about kind of telling people what they, you know, should be doing. It's very much about helping them to figure out what the next steps are for them along their journey. And I think you can't, it's not like a set pathway.
Yeah.
What would you add anything to that, Fiona?
Yeah, I was going to say, I think also it's changing that focus to enable that individual to do the things that they can do, rather than think about the things that they can no longer do. And it's kind of changing that mindset to be able to support them in whatever direction they feel able to take. Because when, and you related to this earlier, Ros, when you have these thoughts that what you've taken for granted as this life with lots of activity, lots of exercise, a career that you clearly enjoyed, and somebody says to you, oh, no, you won't be able to do that anymore. And in addition to that, we will be giving you some medication without knowing how that medication will behave with that individual. And it can be soul destroying to being in that place. And just by looking at it in a different way and say, well, you know, let's focus on the things, for instance, the things you enjoy doing. And you might have to think about that for some time. But there will be things, of course, that you can still do. And then we can build on that as we continue to support that patient.
Thank you, Fiona. One of the things that we were going to get Fiona to talk about was the impact of stress. Ros, was stress a component of you feeling unwell?
Yeah, I'm sure there was, you know, there were some very stressful periods in my life in the kind of the preceding, in the run up to me being diagnosed, certainly. So yeah, I'm sure it was a factor.
Fiona, did you want to?
Well, actually, I was doing a little bit of research, and what they found was that 80% of patients that with rheumatoid arthritis had a stressful event or chronic stress prior to their diagnosis. So that it, you know, it obviously plays a big part in, not the only thing, but a big part in that inflammatory process leading to something like rheumatoid arthritis. So so can I talk a little bit about stress and autoimmunity? Okay. Would you mind just putting up my first slide, please? So on this, as Indra mentioned, you know, there's the three-pronged stool really of things contributing to an autoimmune health issue with leaky gut, the genetic susceptibility, and also stressors. And I've put a few of those on there because 75% of autoimmune conditions are caused by environmental factors, and the top 7 of those, as I say, I've listed some of them, but the top 7 causes would be things like gluten sensitivity, which we've mentioned before, GMOs, which are genetically modified organisms, which are becoming more and more apparent in our diet, from plants to meat to grains, gut dysfunction, which we mentioned earlier, things like neurological stress, trauma, toxins, which we've mentioned, stress and the impacts on hormones, and also infections. So there's a number of different things that can all have an impact on not only whether you develop an autoimmune disease, but also your recovery from that. And if I could go to my next slide, please. I'm sure many of you, looking at the left-hand side of that slide, will see things that apply to all of us at some point. But the thing about stress, if it becomes too large an issue, or it's maintained for long periods, it actually leads to, as Indra mentioned earlier, this inflammatory process, which, if it continues, ultimately results in a chronic illness of some sort. And what I mean by chronic stress is where the stressor or the environmental demands exceed that individual's adaptive capabilities. So it's an overwhelming, uncontrolled stress. And this, on the right-hand side of this slide, you can see that it affects it can lead to all sorts of different chronic health issues. But with regards to autoimmunity, it has a disruptive effect on your immune system. And as I said earlier, actually your recovery from that, if you do not address your chronic stress. And so not only does it contribute to the autoimmune disease, but the disease itself can have a significant can cause significant stress, leading to this vicious cycle and magnifying the problem. So hence the importance of trying to minimize that stress, which I'll come to shortly. If I could go to my last slide, please. Now, this is about how does this stress come about? And the autonomic nervous system is responsible for keeping the balance between one aspect, which is the sympathetic side of the autonomic nervous system, and the parasympathetic. And if I could relate it, say, to a car, if you looked at the sympathetic system as the accelerator, if you will, and the parasympathetic as the brake in that car, in the car. And what the sympathetic system does is, we've maybe all familiar with this fight or flight response, which, without us having to do a thing, automatically provides us with a burst of energy to combat any perceived danger. And by doing that, it increases your heart rate and also the output of your heart to get more blood to all your systems, more, in particular to your muscles, if you have to, run away, for instance. One of the important aspects of it, though, is that the things that are not necessary, or the body feels are not necessary to combat that perceived danger, things like digestion will slow down, and even the motility through the gut will slow down. Breathing quickens, provide more oxygen to the brain and the muscles. There's a release of glucose, so provide energy, and things like increasing sweating to cool the body down. But you can imagine, if this is out of kilter and you have this sympathetic drive all the time through chronic stress, it can cause havoc within the body, and also immune disease is one of those results. On the other side, the parasympathetic side, this is known as the rest and digest and healing side, because it slows down the body, and it calms the body, and very importantly, it allows for recovery and repair after that perceived danger has passed. And all the processes of healing and health maintenance are turned on when you're in this parasympathetic state. So that you can see that by reducing stress, it's critical for reducing inflammation within the body, and ultimately improving your immune health and the symptoms from your health issue. Now, I know in the past we have mentioned some of the tips as a coach that we can support our patients with to minimize the stress in patients with chronic disease. But I think the first thing is, and Indra, you mentioned this earlier, it's important to identify with that individual what are those stresses, and obviously reduce those as much as possible. And in order to identify those, one of the things that is critical is that we take a very detailed history at the practice, so that we can look at what has been going on throughout that whole patient's life, and see when maybe the symptoms started to arise, and whether they could be linked to a kind of stressful time in somebody's life, or, you know, they're still not managing their stress and therefore the disease has progressed. But there's lots of things that Ros and I can suggest to minimize that stress. The important thing is finding whatever techniques is right for you. So for instance, not everyone wants to go and do yoga, not everyone enjoys reading or whatever. So it's tailoring it to that individual. And the other thing is one of the other important things is prioritizing sleep and getting a good night's sleep. So that when dealing with any autoimmune or chronic illness, there can be this feeling, as we mentioned earlier, Ros, this feeling of kind of hopelessness and helplessness, and leading to feeling totally stuck. I don't know where to turn. I don't know what to do. I don't even know how to take that first step forward. And so it's really important that we, as I mentioned earlier, that we take it at a pace that you feel you can cope with, and we can always build up. We can always build up from there, but it is tiny steps. And you know, that's what Ros and I are here for, is to be able to support you in every step of your way to recovery.
Thank you, Fiona. So what we've heard today, and I just want to thank Ros so much for allowing us to explore her history. But when you go back to those 3 questions, where is the stress, pressure, and threat? So there was stress, there was pressure, and the threat was probably from nutritional deficiencies and your gut dysbiosis and things like that you were experiencing. And then what is the state of your gut health? You didn't think you had it, but then you realized about your acidity and things like that. And there was a question here, Ros, how did you find out that you did not have enough stomach acid?
I think I did that burp test.
Bicarbonate soda test.
I called it the burp test. I actually didn't burp. So clearly that was an issue.
Yeah. So what we ask patients to do, it's not scientific as far as I don't know there's been any research done, but it's basically taking half a teaspoon of bicarb soda in a glass of water as the first thing in the morning and seeing how long it takes you to burp. Is that about right? That's what you did? And as long as you burp within 5 minutes, then you've got probably adequate acid.
I stopped. I think I remember stopping, kind of timing it by about 11 minutes and thinking,
not very
yeah.
Excellent. And then how can we reduce the inflammation? So you've reduced your inflammation by looking at your nutrition, taking away inflammatory foods, looking at your toxins, taking away your toxins, looking at your stress and learning how to manage your stress. And overall, that slowly over time, through ups and downs, you've come to a level where you understand what you need. Would that be right?
Yeah, absolutely. I think I can kind of recognize and kind of react to my body a lot more easily than I used to. I think there's kind of you know, I continue to eat the way that I eat that makes me feel good, and people often ask me, oh God, it must be so difficult, but actually I don't feel that anymore, because it's just normal, and I wouldn't want to go back to feeling the way I was feeling. So actually it's just about eating kind of real food and the food that's right for my body now. You know, I don't take any medication now. I'm very grateful for that, because I think, you know, I think we have to acknowledge that some autoimmune conditions you do have to continue to take medication. I feel quite lucky that I was able to come off the medication I was taking completely. And you know, I'm just much more aware that of looking after myself and doing all those things, you know, doing the stress management, you know, eating right, getting enough sleep, you know, doing the exercise. You know, I'm now able to do, you know, my kind of Pilates and my yoga and my long walks, and you know, without any kind of issues. I mean, you know, I'm not 100% in the sense that, like, there are times when, you know, but then, you know, everybody has times when they feel a bit tired or something, but I don't. So I'm just very conscious, I think, that that maybe I need to do these kind of this self-care more than, yeah, kind of average person.
But that's also, isn't it, part of listening and learning to our body, and kind of, you know, even if you don't have an autoimmune condition, there are times when you feel a little bit more tired, and actually that's just your body kind of saying, I need a bit of help here, you know, I need to sleep more or whatever. And
yeah,
that,
I think that's been one of the most kind of interesting things, is that I kind of, you know, it is around that self-awareness and you know, recognizing that, because I think a lot of people are so disconnected from their body. Their minds are kind of, you know, we treat them so separately in society generally, that I think we forget that they are kind of intimately connected. You know, and the kind of the stress factor, you know, your mind and your body, and how that kind of does have a huge impact. And I think you know, I think that was, you know, in some ways I feel grateful,
yeah,
you know, that I've been through this to kind of understand everything about myself and my body, because it really has been a kind of a very, you know, a very big learning curve. And yeah,
thank you. We've got some questions for people. Are psoriasis, from Margaret, are psoriasis and endometriosis autoimmune conditions? Margaret, psoriasis is definitely an autoimmune condition, and I have been supporting a lady with endometriosis, and I think there is an element to it that's autoimmune. I don't think they've found out what it is, but there is definitely an immune response to endometriosis. Does anybody want to add anything to that?
I think there's also the hormone imbalance with endometriosis, isn't there?
Yeah, definitely. That's a massive trigger to it, isn't it? Next question. Oh, that was Diver with the stomach acid. And then, hi Ros, do you have any symptoms? I think you answered that. You've still got occasional symptoms or things like that?
I occasionally get a bit of hand stiffness, but that tends to be probably sugar. If I do have sugar, I do notice that. And occasionally fatigued, but you know, I kind of, it's hard to know whether that's just because, you know, life, or whether it is kind of fatigue that's attached to the kind of autoimmune condition sometimes. But generally, I'm touch wood. I'm in good shape.
Sherza also has put on here, Gabor Mate, when the body says no, how stress causes autoimmune disease. I don't think I've read that. Has anybody had?
Yeah, I've read a bit of his work, and it's yeah, it's very interesting. Yeah,
very interesting. Ali, you've put on here about your experience with autoimmune diseases and blood tests, and saw a naturopath. You also did a lot of the stuff that Ros has done. Nomads, and it's been a 20-year journey for yourself. It's a lonely journey, as GPs are still limited in their knowledge. I think we're slowly getting more GPs. Is that right, Peter?
Yeah, I think we're living proof.
Yeah. And
I was actually quite lucky. I think my GP was actually very supportive, in the sense that she kind of observed what I was doing, and kind of since then she's very supportive in, like, you know, I still have my blood test every kind of 6 months just to kind of monitor where I am, and she's very supportive in that she kind of knows, you know, that I'm very engaged with my own kind of well-being, and I think that's something else that to mention as well, is that it's having that kind of sense of agency over your own body and your own healing. I think we have a system where sometimes people just want to be fixed, and I don't think I think you need to engage with your own health journey to move forwards, and I think that's quite important.
That's lovely, Ros. That's I think that's really a root part of why I created the practice. And it was about giving patients that power back, and empowering them to make choices that feel right, and having the guide to explore it. I mean, not everybody's going to react the same to gluten, not everybody's going to react the same to dairy and things like that. And it's about having that support and that knowledge that, you know what, you have the answer. You have these answers. You just needed to have someone shine a light on this for you to be able to make the choices that you also made. Shazaz also asked a question. Sorry, I missed. How do you find out if you have a leaky gut? Elsa, do you want to take that?
Yeah, I mean, I think a lot of the time we make a presumption that you've got leaky gut because there are food intolerances or sensitivities. I mean, there are other mechanisms involved, I think, in autoimmunity, but you know, leaky gut is certainly a very common one. And if you've got gut symptoms, then you've almost certainly got leaky gut. There are tests that you can do, like a zonulin test, which will give you an idea if you've got a leaky gut.
Do you see patients outside your area as you found a new patient? Me from Birmingham. That's lovely, Shazza. Yes, we see patients outside our area because we through the COVID situation, we went completely online, and that has been, you know, that's been great for us. We've actually really enjoyed it, and as we're developing as a team, we're finding that whole online thing is actually working quite well for us, and we take patients from wherever. If you're willing to take hold of your health and you want some support, we're here for you. Is there any other questions, and does anybody want to add anything? No?
I think there's another question at the bottom there about bowel movements.
Oh yes, here you go. If not regular, can be a sign of leaky gut too, I think. Yeah, definitely. I mean, bowel movements are something that we talk about quite a lot in our practice. The color, the consistency, and all of those kind of, the smell and all of that. And everybody goes, oh, I don't really want to talk about that. But that is so important to us, because the bowel movements tell us so much. It tells us about how stressed you are. It tells us about how you're detoxifying. It tells us about the balance of your gut bacteria. All of those
you're
things.
chewing properly.
Yeah, exactly. It tells us about your hydration. So it tells us so much about the state of your body at this moment in time. And if there is anything that is not, there is no normal. But when I was in general practice, we used to say, well, if you open your bowel once a week and that's normal for you, that's okay. But I would never say that now. I would be like, why are you not opening your bowels? At least a minimum of once a week is what we would say. Anybody want to add to that?
We like snakes.
Yeah. We like snakes as well.
I heard a doctor talk who said that the ideal is that you should have a bowel movement after every meal.
Wow.
So 3 times a day if you eat 3 times a day, but certainly at least once a day.
Margaret's asked a question. What are the top foods that can trigger autoimmune reactions?
Right. Top 10. Wheat, dairy, corn, soy, chicken and egg, tea, coffee and chocolate, yeast, sugar, oats and citrus fruit.
Wow, you've learnt that one, Elsa.
That was my time in the allergy clinic. But it's very individual, but it tends to be the foods that you eat very regularly. So if you imagine the typical Western diet, you know, gluten and dairy figure very frequently in there.
Hence, we're very we're very pro leafy veg.
Yeah. Excellent. If anybody wants to ask a question in person, please feel free to put your cameras on. Otherwise, we will see you all soon. One thing we did want to ask is our next webinar, which will be probably in November, we were thinking of doing a little bit of a question and answer session where you could ask us questions about any conditions. Would that be something that you would like to be part of? And if so, just put a thumbs up. Or if you had any particular areas that you would want us to cover, we're quite happy to look into that as well. That's brilliant. Thank you, everybody. We hope to get this recording out to you and so that you can share it amongst anybody else that you know that might benefit from this. And hopefully we'll get a little top tips, little information leaflet to go out with our little letter. Thank you.
Thanks very much. Bye.
Bye. Bye, everyone.
Bye.
Bye.